higher, higher. And when we keep praising the Lord, the glory comes down. I love it. Higher, higher, higher. When the praises go up, His glory comes down. Higher, higher, higher. When the praises go up, His glory comes down. Higher, higher, higher. When the praises go up, His glory comes down. Higher, higher, higher. When the praises go up, His glory comes down. Hi guys, how are you? This is the Dr. Vic Kenya show, and in our last episode we talked about pneumonia. We are still talking about diseases, communicable diseases that affect the lungs. And if you remember, we said that tuberculosis in a span of 1 year cost the lives of more than 400,000 people. That is not since our countries got independence, but in a span of just 1 year. So what is tuberculosis? Truth of the matter is, it is a disease that mostly affects the lungs. But what you must know is that there is basically no system that is exempted from being affected by tuberculosis. Back in medical school, we are told it will affect every system. If you're a medic, I know you will copy this except the hair and the nails. But remember, we don't know what might happen in the future. So, how do we get this disease? Do we get bewitched to get the disease, or what happens? What happens for me to get tuberculosis? It is caused by organisms, a bacteria commonly known as Mycobacterium tuberculosis. That is what causes tuberculosis. And there are two main ways in which this bacteria can get into your system. One, through inhalation. There is a variant of the bacteria that can get into your system through inhalation. Then there is a second variant of the bacteria that can get into your system through ingestion. Ingestion means swallowing through the mouth. And very many years ago, the forms of tuberculosis which could be gotten by ingestion were very many, and the reason was because of non-processed milk, because that bacteria commonly used to be found in the milk of animals. But nowadays, with the pasteurization of milk, the incidences of oral tuberculosis have gone down. But in some instances, someone who already has TB and has a sputum can swallow that sputum, and that can affect the gastrointestinal system of that patient. So, tuberculosis, one, we've said, can affect the lungs. How will it present when it affects the lungs? You will cough, and it will be a productive cough, meaning there is sputum. And very sad is that sometimes you actually cough up blood, what we refer to medical terms as hemoptysis. And the second thing is, because of how chronic the disease is, you lose a lot of weight. There is weight loss or anorexia, what we call just you don't feel like eating, and as a result, weight loss will be there. The third thing is tuberculosis is an infection, and so it will present with fever, high temperatures. Number 4 for tuberculosis is night sweats. Every day you sleep, you are sweating a lot. You wake up, be it your night dress or the sweatpants that you probably slept with on that day, they are all drenched in sweat. When you see that, don't say, this weather has changed. It is now too hot. Why am I sweating too much? No, that could be a sign of a disease. And then another thing is fatigue, number 5. You become very tired. because the body is sick. And number 6, tuberculosis can also give you chest pain. And at times you experience this chest pain because the disease has affected your heart. And if you're a medic and you're watching this, commonly what we refer to as TB pericarditis. So it is very important that you know these 6 things that I have talked about. In case of any one of them, please do not sit at home with your child or with your husband or wife or with your colleague. Remember, that is a danger sign. Go to a nearby health facility. Stop diagnosing yourselves. Stop diagnosing your neighbors and your colleagues. Health facilities are there. Go get checked and get treated. So what are some of the conditions that are risk factors for one getting tuberculosis? Truth of the matter is, how you can inhale infected air droplets is when you're close with someone who has an active case of tuberculosis. So this person is actively coughing, already have the disease. Whatever this person is coughing out has the bacteria. You inhale it and it goes and affects your lungs. Number 2, staying in overcrowded places. That is really dangerous, because the truth is, in any overcrowded place that you go, there is no screening machine that is saying TB positive, TB negative, TB positive, TB negative. And so at all times, even in your own house, if it is possible for you to have a room ratio of 1:1, if it is possible, or 2:1, then you can apply that. That will help. The number 3 risk factor for very severe forms of tuberculosis is lack of vaccination. I talked about this in my presentation of pneumonia, and I want to insist on it again. Upon birth, there is a vaccine that is given to children referred to as BCG. It is given at birth. But if at all your child missed this vaccine, within 5 years, the same vaccine can still be given to the child. That is according to the guidelines that we have in our country. So please consult on what are the guidelines in your country and act accordingly. The 4th risk factor for tuberculosis is HIV/AIDS. I remember telling you that HIV/AIDS is now the 2nd killer disease in Africa, costing lives of more than 700,000 people. And HIV/AIDS is a significant risk factor for TB, because what HIV/AIDS does to your body is that it reduces the ability of the body to fight off infections, and so you easily get that tuberculosis. Meaning it's very important that you know your status. Please, if you're there and you don't know your status, take a step and know your status. Don't say I'm faithful to one partner. Don't say that. It's good that you're faithful to one partner, but it's even better that you know your status. And I said before that it is a disease that can affect every other system. Tuberculosis can go to your head and give you meningitis. I have seen patients that have been seriously affected by TB meningitis. These patients came, they were not even coughing, but they were having severe headache, neck stiffness, and then we realized later it was tuberculosis. So it is a very dangerous disease. You don't just want to sit and look. TB meningitis is a killer disease. It causes permanent disability if action is not taken at the right time. TB can go to your genitourinary system, which includes the kidneys, and it can affect that. It can go to your abdomen, your gastrointestinal system, and that can be affected. It can go to your spine and cause what you call TB spine, and that is so bad. Once your spine is affected, then you might not even be able to move, depending on which part of your spine has been affected. So, now that we know what TB can cause, what is important for you to do to prevent yourself? Truth of the matter is, we cannot fully control ourselves from being exposed to TB. There are two things. There's one thing called TB infection, and there was what we call TB disease. In TB infection, you have the organism in your body, but the symptoms have not manifested. And for sure, most of you that have already been exposed to people with TB, be it at the workplace or where, probably already have the infection. And then you have TB disease where now the symptoms are there. So this is what we will do to prevent TB. We have what we call screening methods for tuberculosis offered in every country. There is a test that we refer to as the Mantoux test, the tuberculin skin test. It is the same thing. If you think you have been exposed to someone who has tuberculosis, or someone that has had a chronic cough with no known cause, with an unknown cause, please go to the nearby hospital and request for them to screen you for tuberculosis. Depending on the results that will be obtained, the health professionals will follow up with the correct steps. So that is all I have for you today on tuberculosis. If you have any questions, please do not hesitate to text, and I will be willing to respond. Remember, if you have not subscribed to this channel, please click on the subscribe channel and enable notifications, because this information is here to empower you. And I will not stop saying that I love you guys, I cherish you guys, I honor you guys, and may the good Lord bless you. Thank you.